वेलकम बैक टू आरकेवी ब्लॉग्स। आप सभी को आरकेवी ब्लॉग्स में स्वागत है। ठीक है, प्रीवियस जो वीडियो मैंने बनाया था एजुकेशनल स्टडी विथ मी जो ब्लॉग था, ठीक है, उसमें हम फार्माकोलॉजी का जनरली ऑटोनॉमिक नर्वस सिस्टम ड्रग एक्टिंग ऑन एनएस में हम मतलब बहुत पहले, ठीक है, बहुत पहले लगभग 111 क्वेश्चन कर दिए थे। ठीक है, एंड आज हमने 112 से स्टार्ट करके 134 तक ले गए थे। ठीक है, नाउ बाकी हम कोशिश आज करूंगा कि 2200 कम से कम आज खत्म करेंगे। अभी हमारा स्थिति क्या है, 134 पर हम अटक पड़े हैं। ठीक है, इसे हम 200 तक लेंगे। उसके बाद हम थोड़ा मेडिसिन के बारे में जानेंगे। ठीक है, मेडिसिन में मतलब किस रोग में क्या क्या मेडिसिन देते हैं, क्योंकि एक फार्मासिस्ट जो होता है, एक फार्मासिस्ट को 360 अप्रोच होना चाहिए। वो इक्विवेलेंट टू डॉक्टर होता है। एक बी फार्मा का जो स्टूडेंट होता है वो इक्विवेलेंट टू डॉक्टर होता है। डॉक्टर कितने साल की पढ़ाई करते हैं? 5.5 साल की पढ़ाई करते हैं। बी फार्मा स्टूडेंट कितने साल की पढ़ाई करते हैं? 4 साल की पढ़ाई करते हैं। सिर्फ अगर आपको कुछ टेक्निकल स्किल, क्लिनिकल स्किल अगर सिखा दिया जाएगा तो आप नियरली इक्विवेलेंट टू डॉक्टर बन जाओगे। तो छोड़ो, जो चीज जो है, ऐसा बनोगे तो घोड़ा हो जाएगा, तो ये कहावत कहीं ना कहीं फिट नहीं बैठता है। ठीक है, ये हम कहेंगे भी नहीं, लेकिन क्योंकि एज का इनका कोर्स 5.5 साल, हमारा कोर्स 4 साल, तो इसलिए हम बोल रहे हैं। ठीक है ना, कोशिश करेंगे आज 200 क्वेश्चन को खत्म करने के लिए। ओके, ड्रग यूज्ड फॉर पोस्ट ऑपरेटिव रिवर्सल ऑफ मस्कुलर पैरालिसिस। ड्रग यूज्ड फॉर पोस्ट ऑपरेटिव रिवर्सल ऑफ मस्कुलर पैरालिसिस 135 ये गला तमरा ए नियोस्टिकमिन। ड्रग यूज्ड फॉर पोस्ट ऑपरेटिव रिवर्सल ऑफ muscular paralysis neostigmine. Which of the following drug is used to differentiate myasthenia gravis and cholinergic crisis? Which of the following drug is used to differentiate myasthenia gravis and cholinergic crisis? That is called 136. 136 ये गला तमरा A, that is called to edrophonium. In which of the following condition cholinomimetic is not used? कोलिनोमिमेटिक कहाँ पर यूज नहीं होता है? 137 ये गला डी, पार्शियल हार्ट ब्लॉक के केस में यूज नहीं होता है। ठीक है, ड्रग ऑफ चॉइस इन एक्यूट सेंट्रल एंटीकोलिनर्जिक सिंड्रोम इज। ड्रग ऑफ चॉइस, ड्रग ऑफ चॉइस इन एक्यूट सेंट्रल एंटीकोलिनर्जिक सिंड्रोम इज 138। 138 ହେଇଗଲା ତମର B, that is called to साइसोस्टिग्मिन। ठीक अछि। Which one of the following act commonly both on parasympathetic and sympathetic division? 139। 139 ହେଇଗଲା C, acetylcholine। Most commonly used cholinesterase regenerator at neuromuscular junction is। most commonly used cholinesterase regenerator, most commonly used cholinesterase regenerator at neuromuscular junction is 140 ये ही गला A that is equal to pralidoxim. In organophosphorus poisoning, all are seen except in organophosphorus poisoning, all are seen except 141. 141 ହେଇଗଲା ତମର C that is equal to dilated pupil. Type II paralysis in organophosphorus poisoning treatment is 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 142. ये ही गला तमरा C that is called to symptomatic treatment. 142C. Atropine is useful in organophosphate poisoning because it is 143. ये गला तमरा D that is called to is a competitive antagonist of acetylcholine. Which one of the following drugs increases gastrointestinal motility? Which one of the following drug increases gastrointestinal motility? 144. 144 ये है गला तमरा C that is called to neostigmine. A cholinomimetic drug that is useful treating post-operative abdominal distension and gastric atony is 145. ये गला B that is called to bethanical. Following statement about pilocarpine are correct except following statement about pilocarpine are correct except होची 146. 146 से होची तमरा A that is called to it causes bronchodilation. ठीक है. Following statement about pilocarpine are correct. Pilocarpine ऊपर कोरा correct है. It acts on both muscarinic and nicotinic receptor. It causes profuse sweating. It is used in glaucoma. Glaucoma रे भी use होची. It causes profuse sweating होची. It act both muscarinic and nicotinic receptor. But pilocarpine आपका bronchodilation नहीं करता है. Now 147. Galantamine is used in galantamine कोटा होची 147. 147 होची तमरा A. Galantamine is used in Alzheimer's disease. All are the cerebroselective anticholinesterase used in Alzheimer's disease except all are cerebroselective. All are cerebroselective anticholinesterase used in Alzheimer's disease except होची 148. 148 ହେଲା तमरा D that is called to pyridostigmine. ये केवल यूज होनी. All are cerebroselective anticholinesterase used in Alzheimer's disease. Galantamine यूज होची, rivastigmine यूज होची, donepezil यूज होची, बट pyridostigmine यूज होनी. Longest acting drug used in myasthenia gravis. Myasthenia gravis रे longest acting किए drug यूज होची 149. एड्रोफोनियम बने 149. No. Pyridostigmine. Edrophonium as a diagnostic agent shows improvement in the following crisis. Myasthenia gravis 150A. Yes, correct. The following statement about neostigmine are true except 151. 151 hella A. It is used in belladonna poisoning. No. neostigmine belladonna poisoning रे कहाँ यूज होता है? द फॉलोइंग स्टेटमेंट अबाउट नियोस्टिग्मिन आर करेक्ट आर ट्रू एक्सेप्ट होची इट इज यूज्ड इन बेलाडोना पॉइजनिंग। बेलाडोना पॉइजनिंग रे नियोस्टिग्मिन यूज होनी। नियोस्टिग्मिन कोटे यूज होची कोबरा बाइट रे यूज होची। इट डज नॉट पेनिट्रेट ब्लड ब्रेन बैरियर। इट इज यूज टू ट्रीट मायस्थेनिया ग्राविस। ठीक अछि, मायस्थेनिया ग्राविस को ट्रीटमेंट करिया पई किए यूज होची नियोस्टिग्मिन। The following statement about schizostigmin are true. The following statement about schizostigmin are true except कौन 152 ये गला ए इट इज ए ड्रग ऑफ चॉइस इन क्यूरारे रिवर्सल। क्यूरारे रिवर्सल में ये एक ड्रग ऑफ चॉइस जो कि गलत है। सही क्या है? इट इज यूज टू ट्रीट बेलाडोना पॉइजनिंग। बेलाडोना पॉइजनिंग रे साइसोस्टिग्मिन यूज होची। इट पेनिट्रेट ब्लड ब्रेन बैरियर। इट इज यूज टू ट्रीट ग्लाइकोमा। ठीक है। ऑल ऑफ द फॉलोइंग ड्रग मोडालिटीज आर यूज्ड इन मायस्थेनिया ग्रेविस एवर। ऑल ऑफ द फॉलोइंग ड्रग modalities all of the following drug modalities are used in myasthenia gravis ever। 153 ହେଲା ତମର D that is equal to cyclostigmine is used as alternative to pyridostigmine in management। cyclostigmine is used as a alternative to pyridostigmine in management। ठीक है। 153 D atropine overdose may cause which one of the following। 154 है B increase cardiac rate। true about pilocarpine। pilocarpine ऊपर 155 D that is called to causes accommodative spasm। 155 true about pilocarpine। pilocarpine ऊपर कोटा true causes accommodative spasm। mechanism of action of carbamate। carbamate का mechanism of action क्या रह जाएगा? 156 ये गला तुम्हारा A that is called to reversible carbamylation। carbamylation। बेथानिकॉल हैज ऑल ऑफ द फॉलोइंग प्रॉपर्टीज। बेथानिकॉल के पास सारे प्रॉपर्टीज है बट क्या नहीं है? 157 दैट इज इक्वल टू डी इट एक्सर्ट बोथ निकोटिनिक एंड मस्कारेनिक इफेक्ट जो कि गलत है। It is extremely resistant to hydrolysis, correct. Purely muscarinic in its action, correct. It is used for abdominal, urinary, bladder distension. କେତେ 16 ମିନିଟ୍ ହେଇଗଲାଣି। All of the following drug produces either direct or indirect parasympathomimetic effect. All of the following drug produces either direct or indirect parasympathomimetic effect except कि 158 ये ହେଇଗଲା तमरा B, that is equal to atropine। ଆଉ ସବୁ କରିବେ methanical କରିବ, neostigmine କରିବ, nicotine भी କରିବ। Okay, direct acting cholinomimetic that is lipid soluble and often used in the treatment of glaucoma, plicorpin 159D। Which of the following agent is a prodrug that is much less toxic in mammals than in insect? Which of the following agent is a prodrug? Which of the following agent is a prodrug that is much less toxic in mammals than in insect के अपेक्षा। Which of the following agent is a prodrug that is much less toxic in mammal में much less toxic रहेगा insect के अपेक्षा। So 160 ये गला C, that is equal to cystostigmine। Following muscarinic agonist is susceptible to hydrolysis by cholinesterase. Following muscarinic agonist is susceptible to hydrolysis. Following muscarinic agonist is susceptible to hydrolysis by cholinesterase 161D, that is equal to muscarine. Following muscarinic agonist is susceptible to hydrolysis by cholinesterase, so that is equal to muscarine. Pseudocholinesterase differ from true cholinesterase is that 162 ये वाला B, it hydrolyzes acetylcholine at a slower rate. A sympathomimetic amine which increases the force of contraction but reduces the heart rate. A sympathomimetic amine which increases the force of contraction but reduces heart rate, that is equal to 163 ये ହେଇଗଲା तमरा B, that is equal to norepinephrine। muscarinic cholinergic receptor किसको 164 ହେଇଗଲା तमरा C, that is equal to muscarinic cholinergic receptor are present on vascular endothelium which has no cholinergic nerve supply. Muscarinic cholinergic receptor are present on vascular endothelium which has no cholinergic nerve supply. Neostigmine antagonize non-depolarizing blockade by all of the following mechanism except 165, that is equal to C, increasing the release of acetylcholine at the motor end plate. Botulinum toxin produces skeletal muscle paralysis by botulinum toxin produces skeletal muscle paralysis by 166 B, इनिबिटिंग रिलीज ऑफ एसिटिलकोलिन, एसिटिलकोलिन का जो रिलीज होगा उसको ये इनिबिट कर देगा। बोटुलिनियम टॉक्सिन प्रोड्यूसेस स्केलेटल मसल पैरालिसिस by inhibiting the release of acetylcholine. Which of the following statement is false? Which of the following statement is false? That is equal to 167. ये गला A. Hemicoline prevents the release of acetylcholine from the storage vehicle. Hemicoline prevents the release of acetylcholine from the storage vehicle, जो कि एक false statement है। Botulinum toxin inhibit acetylcholine release, correct. Pralidoxim reactivate acetylcholine storage. Organophosphate inhibit acetylcholine storage. Organophosphate क्या करेगा? acetylcholine storage को inhibit कर देगा। 168. Besides stimulation of a M3 receptor located on endothelial cell, the main mechanism of a vasodilatory action of acetylcholine include which of the following? Besides stimulation of a M3 receptor located on endothelial cell, the main mechanism of a vasodilatory action of acetylcholine include which of the following? 168 ହେଇଗଲା ତମର B, that is called to inhibition of a norepinephrine release from adrenergic nerve ending. So 168 ହେଇଗଲା B. Which of the following organ is innervated only by parasympathetic nerve? Which of the following organ is innervated? इनमें से कौन सा organ innervated होता है only by parasympathetic nerve? 169 ହେଇଗଲା ତମର B, that is equal to ciliary muscle. 169B. Okay. Pyridostigmine differ from neostigmine is that pyridostigmine differs from it is more potent orally, it is longer acting, it produces less muscarinic side effect, it does not have any direct action on NM receptor. So 170 करेक्ट आंसर हो जाएगा बी, इट इज लॉन्गर एक्टिंग। पायरिडोस्टिग्मिन डिफर्स होता है नियोस्टिग्मिन से, दैट इट इज ए लॉन्गर एक्टिंग। 170 खत्म। गोटे पेज। The site of action of myotics for therapeutic effect in angle closure glaucoma is the site of action of myotics for therapeutic effect in angle closure glaucoma is 171. D, that is called to sphincter pupillae muscle. Following agent inhibit the release of norepinephrine. Following agent inhibit the release of norepinephrine from sympathetic nerve terminal except होची 172A. Methoxamine. Hysterin is another name. Hysterin is another name for किसके लिए? 173A, that is called to cystostigmine. Following drug is used for the regeneration of active enzyme from the organophosphorus cholinesterase complex. Following drug is used for regeneration of active enzyme from the organophosphorus cholinesterase complex. 174 ये गला B, that is called to pralidoxim. Following muscarinic agonist is susceptible to hydrolysis by cholinesterase. Following muscarinic agonist, जो भी muscarinic agonist होता है is susceptible to hydrolysis by cholinesterase. 175 ହେଇଗଲା B, that is called to methacholine. Drug acting on glaucoma. Uveo-scleral outflow of aqueous humor is increased by uveoscleral outflow of aqueous humor is increased by 176 a pilocarpine. Match the following drug classes. Okay, ठीक है 177 177 ହେଲା ତମର ସି। वन ହବ କ୍ୟୁ ସାଇସୋଷ୍ଟିଗମିନ୍ ଟା ତମର ହେଇଯିବ ମାୟୋଟିକ୍ସ। ବ୍ରିଞ୍ଜୋଲାମାଇଡ୍ ତମର ହେଇଯିବ କାର୍ବୋନିକ ଆନାହାଇଡ୍ରେଜ ଇନହିବିଟର। ବ୍ରିମୋନିଡିନ୍ ତମର ହେଇଯିବ ଆଲଫା ଆଡ୍ରେନର୍ଜିକ୍ ବ୍ଲକର। ଟିମୋଲୋଲ ହେଇଯିବ ତମର ପ୍ରୋଷ୍ଟାଗ୍ଲାଣ୍ଡିନ୍ ଆନାଲଗ। ଲାଟାନୁପ୍ରଷ୍ଟ ତମର ହେଇଯିବ 4 नंबरटा आर। ठीक है टिमोलोल क्या हो जाएगा 4 नंबर 177 सी तो सी 4 नंबरटा होची आर टिमोलोलटा होची बीटा आड्रेनर्जिक ब्लॉकर। लाटानोप्रोस्टा होची 5 नंबरटा होची पी दैट इज कॉल्ड टू प्रोस्टाग्लैंडिन एनालॉग। लाटानोप्रोस्ट प्रोस्टाग्लैंडिन एनालॉग। ठीक है डर्जोलामाइड इज ए कौन डर्जोलामाइड 178 बी topical carbonic anhydrase inhibitor. Which of the following drug is not used in acute angle closure glaucoma? 179 B clozapine. Which of the following cholinomimetics is commonly used in the treatment of glaucoma? Pilocarpine. Which of the following cholinomimetic is commonly used in the treatment of glaucoma? Pilocarpine. हे भगवान भगवान Which of the following arachidonic acid derivative is used in the treatment of glaucoma? 181 latanoprost. Which one of these carbamates is used in glaucoma? Which one of these carbamates is used in glaucoma? All of these. Which one of these carbamate is used in glaucoma? No. 182 B carbachol. Which of the following drug can be used to reduce intraocular pressure in the treatment of a glaucoma? I think 183. No. D. Pilocarpine, timolol, acetazolamide. ठीक है जी. Which of the following drug can be used to reduce intraocular pressure in the treatment of a glaucoma? That is called pilocarpine, timolol, acetazolamide. Anti-glaucomatous drug. Anti-glaucomatous drug causing spasm of accommodation. कौन सा एंटी ग्लाइकोमेटिक ड्रग आपका स्पाजम ऑफ एकोमोडेशन कॉज करता है? 184 बी पिलोकार्पिन. ठीक है जी. Which of the following anti-glaucoma medication is unsafe in infant? A 185 ହେଲା ତମର B. Brimonidine. Which of the following is a indication for using phenyl substituted prostaglandin F2 alpha latanoprost? Which of the following is the indication for using phenyl substituted prostaglandin F2 alpha latanoprost? 186 तमरा है जीवो A. 186 है जीवो तमरा A. That is called to maintenance of a ductus arteriosus. Which of the following drug is not used topically for treatment of open angle glaucoma? Which of the following drug is not used? इनमें से कौन सा ड्रग यूज नहीं होता है टॉपिकली फॉर द ट्रीटमेंट ऑफ ओपन एंगल ग्लाउकोमा? 187. No. Acetazolamide. Which of the following anti-glaucoma medication can cause drowsiness? D. C. Brimonidine. Pilocarpine reduces intraocular pressure in person with closed angle glaucoma. Pilocarpine reduces intraocular pressure in person with closed angle glaucoma by 189. C. Increasing aqueous humor outflow. କେତେ ସମୟ 36 ମିନିଟ୍ ହେଇଗଲାଣି। Now, mechanism of action of a beta blocker in glaucoma. Mechanism of action of a beta blocker in glaucoma. 190. हे भगवान. B. Decrease aqueous production. aqueous production को डिक्रीज कर देता है. Mechanism of action of a beta blocker in glaucoma. Decrease aqueous production. Which of the following drug act on the trabecular meshwork and affects the aqueous outflow? Which of the following drug act on trabecular meshwork and affects the aqueous outflow? 191. B. That is called to pilocarpine. All of the following agent are used in glaucoma treatment. glaucoma treatment में use होता है except 192. That is called to D. मेटफ्रोलॉल एक्सेप्ट होता है. टिमोलॉल यूज होता है. अप्रा क्लोनिडिन पिलोकार्पिन यूज होता है. Topical application of timolol to the eye would be expected to induce which of the following? 193 C. Decreased formation of aqueous humor. A drug that is useful in glaucoma and high altitude sickness is a drug that is useful in glaucoma and high altitude sickness is acetazolamide. Which of the following drug is contraindicated in glaucoma with acute anterior uveitis? Which of the following drug is contraindicated in glaucoma with acute anterior uveitis? ये क्या होता है? 195 बाद में देखेंगे सब. 195 ହେଇଗଲା ତମର A. Latanoprost. Shortest acting anticholinesterase is 196. 196. Shortest acting anticholinesterase is 196. A. Edrophonium. Shortest acting anticholinesterase is edrophonium. Anticholinergic drug. The drug of choice for mushroom poisoning is. The drug of choice for mushroom poisoning is 197. C. Atropine. Which is not an effect of atropine? Atropine का क्या effect नहीं है? 198. A. Rise of body temperature is not an effect of atropine. ठीक है. 198 आपका हो जाएगा A. Which of the following anticholinergic agent does not cross the blood-brain barrier? Which of the following anticholinergic agent doesn't cross the blood-brain barrier? 199. 199 ये गला A, that is called to glycopyrrolate. ठीक है जी. 199 A. Which of the following anticholinergic agent does not anticholinergic agent ହେଇଥିବା ଦରକାର ଯିଏ କି ବ୍ଲଡ୍ ବ୍ରେନ୍ ବ୍ୟାରିୟରକୁ क्रॉस କରି ପାରୁନଥିବ, that is called to glycopyrrolate. ठीक ଅଛି. Now which of the following is not a tertiary amine? Which of the following is not a tertiary amine? इनमें से कौन एक tertiary amine नहीं है? ठीक ଅଛି. 200 200 200 200 ହେଲା ତମର C, that is called to glycopyrrolate. Anticholinesterase with central action. Anticholinesterase with central action. भाई आपका साइसोस्टिमिन हो जाएगा. Yes, correct. Use of tiotropium. Use of tiotropium is contraindicated in 202 ये गला B, that is called to urinary retention. Use of tiotropium is contraindicated in urinary retention. 202 B. All of the following drugs are used for the treatment of urinary incontinency except होची 203 ये वाला B. इप्राट्रोपियम जो होता है वो एक्सेप्ट होता है. ठीक है. All of the following drugs are used in the treatment of urinary incontinence except होची इप्राट्रोपियम. आउ सब यूज होची urinary incontinence रे. कौन कौन? ऑक्सीब्यूटिनिन, तापरे डारिफेनासिन, टॉलटेरोडिन. एट्रोपिन कैन कॉजेस. एट्रोपिन क्या कर सकता है? 204 204 ହେଲା तमरा D, माइड्रियासिस करिवो. ट्रीटमेंट ऑफ एट्रोपिन टॉक्सिसिटी क्या हो जाएगा? B. 205 205. ट्रीटमेंट ऑफ एट्रोपिन टॉक्सिसिटी साइसोस्टिग्मिन. पायरेनजेपिन एक्ट ऑन व्हिच रिसेप्टर? पायरेनजेपिन को रिसेप्टर ऊपर एक्ट करे. 206 206 ହେଲା तमरा A, मस्कारेनिक रिसेप्टर. ठीक है. Following is a synthetic analog of atropine used an inhalational drug in asthma. All of the above: benztropine, pyrenzepine, ipratropium. I think D हो 207 है. No. Ipratropium. Atropine is most sensitive to atropine. Most sensitive 208 है. 208 ହେଲା ତମର A. Mucus and pharyngeal secretion. Atropine is most sensitive to mucus and pharyngeal secretion. Atropine is used in all except atropine सभी में यूज होता है लेकिन कहाँ पर यूज नहीं होता है. 209 ए ग्लाउकोमा रे यूज है नଥାଏ. Antidote for nicotinic poison. Nicotinic poisoning ପାଇଁ କୋଉଟା यूज होଉଛି? I think 210 ट्राइमेथाफान 210 ये गला तमरा C. All of the following stimulate peristalsis except होजी neostigmine, bethanical, metoclopramide, atropine. क्या हो जाएगा करेक्ट आंसर? 211 D. atropine. Which drug is used for antagonist of M3 receptor? Which drug is used for antagonist of M3 receptor? M3 receptor का antagonist. Which drug is used for antagonist? Which drug is used for antagonist of M3 receptor? M3 receptor का कौन सा ड्रग एंटागोनिस्ट के हिसाब से यूज होता है? 212 ए है गला बी. दैट इज कॉल्ड टू डारिफेनासिन. 212 डारिफेनासिन. Indicate the drug which is rapidly and fully distributed into the CNS and has a greater effect than most other and agent. Most others and agent. 213 ହେଲା. 213 ହେଲା B. Scopolamine. ठीक है जी. Which of the following drug is indicate the drug which is rapidly and fully distributed into the CNS and has a greater effect than most of the other agent, that is called to scopolamine. Which of the following drug is both a muscarinic and nicotinic blocker? 214 ହେଲା तमरा B. benztropine. Which of the following drug is both muscarinic and nicotinic blocker? That is called to benztropine. 214 B. Indicate a muscarinic receptor drug. Indicate a muscarinic receptor blocking drug. Muscarinic receptor blocking drug. 215 ये गला तमरा A. that is called to scopolamine. The group of nicotinic receptor blocking drug consists of 216 I think D हो. D correct. Ganglionic blocker और है neuromuscular junction blocker. The group of nicotinic receptor blocking drug consists of ganglionic blocker, neuromuscular junction blocker. Okay. Select the drug below that are considered anticholinergic. Select the drug below that are considered anticholinergic. 217 C. ipratropium. ठीक है जी. Sympathomimetic drugs are useful in the therapy of all of the following condition except होची 218 ହେଲା तमरा D. that is called to erectile dysfunction. Sympathomimetic drugs are useful in the therapy of all the following condition except होची erectile dysfunction. But आउ सबुतरे यूज होची acute decompensated heart failure, hypotension, तापरे हे गला hypertension. ठीक है। सो आज आम फार्माकोलॉजी 218 जाके आज आम पूरा मतलब प्रैक्टिस हो गला। ठीक अच्छे। तो मु कहीपरि आज 100 क्वेश्चन टोटाली फार्माकोलॉजी रे भी सरीगला आ फार्माकोग्नोसी रे सरीगला। तो आज दिन भितर 200 क्वेश्चन तो आमर सरीगला। वर्तमान नाउ टिके ड्रग ऊपर आम पाठ पढ़िया कारण सबू कवर हवा दरकार। ये वर्तमान सरीगला आ काम किछि नहीं। सो आज ब्लॉग को ये रखिए। थैंक्स फॉर